Dr. D. Sangeeta is currently a senior lecturer at the Department of Chemistry, Anna University, Chennai. She has completed her PhD in the field of polymer chemistry from the University of Madras in the year 2000 and has teaching and research experience of more than 10 years. Her research interests are in the following fields: fuel cells for clean energy, functional membranes for desalination, and polymers for biomedical applications. She has published more than 20 research articles in national and international journals and has more than 40 research articles in national and international proceedings. Presently, she is guiding 6 research scholars for their doctoral.
Welcome to the UGC lecture series on the topic of polymers in drug delivery, part 2. In part 1 of the same topic, polymers in drug delivery, we got introduced into what are drug delivery systems and how do the polymers play a great role in delivering the drugs into our human body by way of drug delivery systems. A little more introduction and a defined detailed report on how these drug delivery systems are working on with the different kinds of biodegradable polymers in our life. So, here in this part 2 we will be dealing with the following information. As an outline, we will be talking about what is called the traditional drug release and how they are different from the controlled release systems. Then we will be talking about what is called the targeted drug delivery in our body and the difference between sustained and controlled drug release systems. And the drug release in our body happens by two means. One is called the bulk erosion method, the other one is surface erosion of the polymers to release the drug into our body. A detailed report on these two types of release will be discussed, followed by the general advantages and disadvantages of making use of such drug delivery systems. And then what do we mean by an ideal system or an ideal drug delivery systems? What are the essential characteristics for a drug delivery system to be ideally fitting in? And then finally, we will be moving on to the goal of the more sophisticated drug delivery systems, the primary goal that we are in need for making use of such sophisticated systems to deliver our medicine or drugs into our body. Now, let us move on to what is called the traditional and the controlled release systems. First, the traditional release. With traditional administration, the drug active must remain between a maximum blood level value, which may represent the toxic level, and a minimum value below which the drug is no longer effective. That means, we do have a maximum blood level and a minimum blood level value between which we expect the drug to work, or the drug should be available between these two extreme limits of the toxic level and the minimum level below which it is no longer effective. But in the case of traditional administration, this does not happen. Hence, we now go on to the second type of release, that is having more control over the release of the drug into the body, which is called the controlled release. So, in the case of controlled release, with the controlled administration of the drug into our body, the blood levels are constant between the desired maximum and the minimum for an extended period of time. That means, it is possible to have the drug administered into our body in a controlled fashion, which does not go beyond the toxic maximum level and which does not come down below the minimum requirement of the drug, which is required to rectify the problem in our body, and this also happens over a period of time, extended longer period of time. So, the same thing can be explained with this particular graph, what is called the traditional release and the controlled release of the drug dosing. In the first graph, we can see the x axis represents the time. So, in the case of traditional system, when the dose is applied here, it slowly increases in its level that is the concentration of the drug in the blood goes beyond 2 marks. The first line represents the maximum desired level beyond which it should not be increased, and the second parallel line indicates the minimum effective level below which again the drug should not be going down, below which there is no effect because of the feeding of the drug into our body. So, it should be retained between these two lines of maximum and minimum level. But what happens in the case of traditional release of the drug, when the dose is given, it goes to a maximum value which goes beyond the maximum desired level, and it simply comes down over a period of time even below the minimum effective level. Once again the dose is given, it again reaches a maximum, goes out of the level and comes down. So, this is the fashion or the method that is happening when a drug is put into our body in the traditional method. So, this is what is controlled in what is taking place in the controlled release drug dosing. So, once the dosage is given in the second case, that is in this controlled release case, the dose passes on from a minimum value to a maximum value, where the maximum value is well below the maximum desired level, and it never goes up and down, but it is having a sustained release, a constant stable uniform release of the drug happens over a long period of time. There is no increase or decrease happening, but it is controlled in a line which is well below the maximum level and well above the minimum effective level. Once all the drugs are consumed, at the end the total release happens from the delivery systems, from the controlled delivery systems, and then it reaches the minimum value and then the nil value. So, you have an effective control throughout the longer period of time when we are going to make use of the controlled release systems than the traditional method. Now, what do you mean by targeted drug delivery? Targeted drug delivery is nothing but when a drug is carried by a polymer carrier like this, they go and target the place where it has to give the remediation or it should go and treat it. So, whenever there is a site of target where the remediation has to take place, the drug delivery system should provide a way to release the drug at the site of requirement or at the target site. That is what we call it as target drug delivery system. This can be schematically represented by this particular picture. You have the drug carrier, a polymer capsule, let me say, into which the drugs are available. When it is going to have the releasing of the drug from the carrier, then it goes and then directly goes and reaches the target, that is a cell where the mechanism has to take place in treating the disease or whatever it is. Now, these drugs, they go and attack the sites or the targets of the cell and the mechanism of releasing, and this becomes effectively acting towards the a site of disease. This is called targeted drug delivery. Having seen these targeted drug delivery, now let us have a differentiation between what is called the sustained release and the controlled release. There is a small difference between sustainability and a controlled way of releasing the drug. First one is sustained release of the drug. In the first case, the sustained release, the term sustained release is used to describe a pharmaceutical dosage form formulated to retard the release of a therapeutic agent such that its appearance in the systemic circulation is being delayed and or prolonged. That means there is a sustaining character happening, sustaining behavior in the release of the pharmaceutical dosage that is happening in our body, which is going to release out the drug or the therapeutic agent. It happens in such a way that its appearance or its release happens in a systemic circulation, which is either delayed or prolonged. This is called sustainable release or sustained release of the drug in our body. Whereas, the controlled release is slightly different from the sustained release. Sustained means it is there throughout the period. Controlled release, as the term says, it is a controlled form of release. This term, on the other hand, has a meaning that goes beyond the scope of the sustained drug release or sustained drug action. What does it mean then? The controlled release also implies a predictability and a reproducibility character in the drug release. So, it is not only a sustained drug release happening, but the predictability, the amount of drug that is released at a particular point and the reproducibility effect is going to be predicted, or it is going to be known to us. So, that is the meaning implied due to the word controlled release. So, in the case of controlled release, this is different from the sustained release of the drug, as the word implies a predictability and reproducibility in the drug release kinetics. That means, it is not only predictable how much amount of the drug is getting released over a period of time, and it also is reproducible at every point of time. That is what is gained in the case of controlled release of a drug. So, in this case, which is different from the sustained release, it implies a predictability and reproducibility in the drug release kinetics, which means that the release of the drug ingredient from a controlled delivery system proceeds at a rate profile that is not only predictable kinetically, but also reproducible from one unit to another. The meaning is that it is possible to have the release of such drugs in a controlled fashion, which has a hand in the control over the predictability, that is, its kinetics is predictable over a period of time. How much amount of release of drug has to take place, that is under control, under complete control. Also, it is possible to have a reproducible effect from one unit to the another unit. You know what is happening, how much amount is released kinetically with respect to time, and also know, or we can measure the reproducibility factor, which is uniform from one batch to the other or one unit to the other. This is what is added up in the case of controlled release, which makes them distinctly different from the sustained release of the drug. Now, let us move on to the mechanisms, release mechanisms, that is drug release mechanism. Drug release mechanism can happen in all these three means. One is by a simple diffusion method. Due to the difference in the concentration of the drug in a particular area, it diffuses out and then goes. The second release could be due to the degradation of the polymer. Now, this polymer is nothing but the carrier for the drug, which carries the drug and releases at a site. So, this can also happen due to the degradation of the biodegradable polymer that is used as a cover or a carrier. Or the third type, it could also be a combination of both diffusion and the degradation of the polymer. Let us move on to the polymer section, that is polymer degradation method. This polymer degradation, in order to release the drug out of it, can undergo the degradation by any of these three methods. One is enzymatic degradation. This happens naturally in our body. When it is put in our body, the enzymes and the natural environment in our body condition go and degrade the polymer and make the drug to get released out of the carrier, that is a polymer carrier. So, it can happen, the degradation of the polymer can happen due to the enzymatic degradation, or it can also happen due to a simple hydrolysis. Hydrolysis is nothing but addition of water. So, simply by the hydrolysis mechanism or process, also the polymer can simply degrade, and because of the degradation of the polymer, again the drug inside of which can be released out. Or the third method, it could be a combination of both enzymatic degradation and a simple hydrolysis process that can take place or attack the polymer chain to degrade it and make the drug to get released out. Now, once again, the hydrolysis type of degradation may take place in two ways. One is called bulk erosion, the other one is called surface erosion. Bulk erosion means the erosion or the hydrolysis or the degradation of the polymer takes place throughout the bulk, throughout the polymer carrier material. If it happens, there could be an initial burst of the drug which could be immediately released into the system. Such character can be required in certain applications. At the same time, you also have another type of erosion called surface erosion. In the surface erosion, the hydrolysis takes place on the surface and slowly it moves inwards, and then there is a sustained and a controlled release of the drug that happens in the case of surface erosion. So, people are more interested in such a type of surface erosion in order to reach a controlled and sustained release of the drug from the polymer carrier. Let us have a short break and then continue. Welcome back after the short break. We were discussing about the different release mechanisms, out of which the hydrolysis of the polymer degradation is more important. This can take place in two ways. One is surface erosion, the other one is bulk erosion. Let us have more details about these two types of erosion. Drug release by erosion. Modern delivery systems, they employ the polymers which are basically biodegradable in nature. They make use of biodegradable polymers in order to effectively have the erosion process. When the polymer is exposed to water, hydrolysis takes place or occurs. Hydrolysis degrades the larger polymer molecules into smaller biocompatible compounds. So, this is more important. The point which is to be noted here is, when we make use of a biodegradable polymer as a carrier for the drug, when they are subjected to the exposure of water, they undergo what is called the hydrolysis. And during the hydrolysis process, these biodegradable polymers, which are longer polymer chains, break down or degrade down or decompose down into smaller molecules, and such smaller molecules are once again should be biocompatible compounds in order to make them to go off in our metabolic system by itself. It should not go and release some other toxic effects in our body. So, they degrade the larger polymers into smaller biocompatible compounds, and such a decomposition takes place either by bulk erosion process or by surface erosion process. Now, this can be schematically explained like this: the hydrolysis process. When the water attacks the different bonds, the covalent bonds of the polymer, let us assume that this is a polymer chain with a number of monomer units. These blue blocks, they indicate the number of monomers joined together to form the long polymer chain. When such a bond between the monomers are attacked by the water, that is due to the hydrolysis degradation, they break down and become smaller and smaller molecules. Once again they are attacked here, even more smaller molecules they become. So, finally, the whole of the polymer chain is being attacked by the water, undergoes the hydrolysis process, and then finally they are left with smaller biocompatible compounds like this individually with very low molecular weight when compared to the initial polymer molecular weight. So, this is what schematically explained how the hydrolysis takes place in a polymer chain. Now, what is about bulk erosion? There are few examples of polymers like polylactides, polyglycolic acids, or PLA, shortly called as PGA, and the copolymers of PLA, PGA. All these kinds of biodegradable polymers are very well used for the bulk erosion process. So, what happens in a bulk erosion is that when such a polymer is exposed to water, immediately hydrolysis occurs, and hydrolysis leads to the degradation of the larger polymers into smaller biocompatible compounds or molecules, and these smaller molecules or compounds diffuse out of the matrix through the voids caused by swelling. So, parallelly, due to the absorption of water, swelling also happens, and hydrolysis also is taking place parallelly, due to which the higher molecular weight polymers are brought down to lower molecular weight compounds which are biocompatible in nature, and these such biocompatible smaller compounds and molecules, they diffuse through the polymer matrix through the voids which are caused due to the swelling process in the same system. So, what happens is, loss of the small compounds, they accelerate the formation of such voids, thus the facilitating of the exit of the drug molecules takes place. So, once the smaller compounds are formed and they get diffused through the voids due to the swelling process happening, they make the formation of the voids. These voids, they accelerate the exit or movement of the drug or the release of the drug molecules from inside of the polymer, from the bulk material to the outside environment. So, this is what is happening in the case of bulk erosion. This can be once again diagrammatically explained by this particular slide. You have the polymers, you have the polymer chain, the light blue, and the dark blue, they represent the drug molecules. Once water is added, the polymer is subjected to swelling as well as hydrolysis process. It swells like this and increases in its volume. Hydrolysis takes place and smaller molecules are formed. Such biocompatible molecules, they diffuse outside due to the more number of voids that are formed, and over a period of time, after some time, the drug is able to get released outside. This is the schematic representation of the bulk erosion. So, how the surface erosion is different from this bulk erosion? What is the mechanism? How it is taking place? Let us see that now. In the surface erosion method, for example, polymers such as polyanhydrates, polyorthoesters, or some of the examples of the biodegradable polymers which specifically undergo what is called the surface erosion and not the bulk erosion. Here in this case, when such polymers are exposed to water, hydrolysis occurs. Hydrolysis degrades the larger polymer molecules into smaller biocompatible compounds, and these smaller compounds, they diffuse from the interface of the polymer. This leads to the loss of small compounds which reveals the drug that is trapped within itself. Now, you have to make a note here that these polymers do not swell or do not absorb the water and swell in volume, but they only release by getting shrinked down. Hence, you can once again diagrammatically explain the surface erosion like this. This is a polymer carrier with a drug. Once the water is added into the system, it allows the smaller molecules to get released out, and the drug carrier squeezes down or comes down in its size. It does not swell but come down, and because it is coming down, there is going to be a release of the drug which is automatically taking place on the surface. Now, you can see the drugs, they do not come from the inside directly, but they only get released on the surface, and such a type of erosion, you call it as surface erosion. Now, let us move on to the different polymers for controlled release systems that are conventionally used. Following are some of the first materials selected for various delivery systems based on their intended non-biological physical properties. They are all basically biopolymers or biocompatible polymers, or you can even call them as biodegradable polymers, but these polymers have been chosen as the first materials initially due to their very important physical properties or non-biological characteristics of them. Such polymers are polyurethanes, and they have been selected for their elastic property or elasticity. Polysiloxanes, they were chosen for the insulating ability. Polymethyl methacrylate, they were taken for the sake of physical strength as well as transparent character of the polymer. Polyvinyl alcohol were selected for their hydrophilicity character and swelling property. Polyvinyl pyrrolidone were chosen for their suspension capabilities. So, each one of these polymers were initially used for the different properties they possess as their inherent characteristics to make use of them as the drug release polymeric materials. And now the current polymers that are being used in controlled drug delivery, these polymers became usable in controlled delivery systems due to their inert physical characteristics and being free of any leachable impurities. Based on this requirement, following are the different polymers selected for the controlled drug delivery systems, and they are poly 2-hydroxyethyl methacrylates, poly N-vinyl pyrrolidone, polyvinyl alcohol, polyacrylic acids, polyethylene glycol and polymethacrylic acids. Most of these polymers, they undergo easy hydrolysis in order to have either the bulk erosion or a surface erosion to release the drug outside them. Now, let us talk about the bioerodible and biodegradable polymers used for control release systems. These are the polymers that are designed to degrade within our body. They are polylactides, shortly called as PLA, polyglycolides, PGA, copolymers of polylactides and glycolides, PLGA, polyanhydrides and polyorthoesters. So, these are the different polymers where you have either the esters or acid groups where you can have a direct attack or the hydrolysis process taking place in such functional groups which makes the polymer to break down in its size and release the drug. And these three polymers, the first three polymers, they undergo a bulk erosion, whereas these two they undergo a surface erosion. Degradation of biodegradable polymers. These materials, they degrade within the body as a result of natural biological processes happening in our body, eliminating the need to remove a drug delivery system after the release of the active agent has been completed. So, basically these are the materials or biodegradable polymers that are utilized in our body to release the drugs or any active agents into our body, and they also eliminate the step of removing such systems in our body, since they undergo a natural biological process within the body and then they go out of our body system. And this happens by bulk hydrolysis and surface eroding. The polymer degrades in a fairly uniform manner throughout the matrix in the case of bulk hydrolysis, whereas in the case of surface eroding, the degradation occurs only at the surface of the polymer, resulting in a release rate that is proportional to the surface area of the drug delivery system. So, having seen all these details, let us sum up, and in the summary we have seen about the traditional and controlled release systems. We have learnt about what is called the targeted drug delivery. We have also highlighted the important differences between the sustained drug release and the controlled drug release, and then finally we touched upon the various drug release systems happening by two important means, namely the bulk erosion and the surface erosion. Here are few questions to answer. What is the difference between traditional and controlled drug release? What are the advantages of targeted drug delivery? Bring out the differences between sustained and controlled drug release. Compare bulk and surface erosion of drug release, and what are biodegradable polymers. Thank you.